So I'm Rachael, I'm one of the clinical nurse specialists at the Christie. I work very closely with Professor Bloor and the rest of our haematology consultant team. I work in a team of 5 haematology CNSs and we kind of all take different leaderships on different disease groups. So for example, I specialise in ALL and CLL, and my job role in simple terms is to be an extra level of support for patients throughout their diagnosis, their treatment journey, and throughout ongoing care really. So what is shared decision making? I'm just going to talk to you a little bit today about our role in shared decision making. It's defined as a collaborative process that involves a person and their healthcare professional working together to reach a joint decision about care. This slide just goes through a few different ways in which we do that. So on an initial meeting with a patient, whether that's at diagnosis, whether that's at the start of treatment, or sometimes it's just even in like a clinic appointment, we tend to complete what's called a holistic needs assessment. And this is an evaluation of a patient's background, understanding their personal circumstances, and if they're at the point of treatment, how this can influence treatment decisions. We assess 5 key areas in this. So that's their physical needs, their social needs, their emotional needs, cultural needs, and obviously the practicalities of being treated. When we talk about their physical needs, as Professor Bloor's already gone through, this includes things like their age and their fitness, their comorbidities, any symptoms that they already have or they think might have when we talk about treatment. When we look at social, emotional and cultural aspects, this is kind of where your personal preferences come in regards to cultural things. Then there's the emotional side of it, which is how you're feeling. Do other services need to be involved? What support can I offer? Who can I refer you to provide just an additional level of support? It can obviously be a really stressful and unnerving time, whether that's at starting treatment or whether that's at diagnosis or at any point in your journey. So knowing your background and who best to refer you on to for further support is really important. And then there's the social aspects. So do you work? What's your family life like? How can treatment fit around you? And Professor Bloor's already gone into this quite a little bit. But yeah, from my perspective, it's getting a whole picture. It's not just a case of let's do this treatment now. It's getting a whole picture and understanding your preferences. And then from a practical factor, this often involves where patients live, your mobility, distance to travel. For example, I was talking to Jazz earlier and lives in York, but he's being treated in Leeds. It's not exactly around the corner. So we've got to take things like, how can you get to the hospital? Can you come in frequently? How are you going to get to your follow-up appointments? Things like that. Next is patient education. So this is a major part of my role actually, and it's making sure that you guys as patients understand the treatment regimes that you're going to be having, any side effects, the risks versus benefits of starting treatment, and this involves staying up to date on all research. So keeping myself well informed helps you guys to make autonomous and informed decision making. Obviously, as we've already discussed, starting treatment, there's like a sweet spot to start in it. Making sure you're educated during that sweet spot can encourage starting treatment at the right time, and if it's right for you guys and your lifestyle, and during if you work as well, if you've got kids, all things like that come into play. It's not just as simple as you need treatment, let's start now. In turn, this talks about liaising with multiple teams. So whilst all discussed above, I'll liaise with Professor Bloor and any of the other haematology consultants that are involved in your care. It also means discussing with external teams. So if you live far away and you can't come back for bloods very often, this might include discussing with your GP, your local services, to see if we can maybe facilitate treatment with us and also closer to home, making it an easier process for you guys, and supporting you through that journey. Like I said, people being treated at the Christie in particular travel from all over. We have patients from Wales, etc., so on and so forth. And they can't come back once a week for bloods, twice a week for bloods. It can make a big difference in terms of oral treatments versus IV treatments, the intensity of treatments patients get. Being able to discuss with teams closer to home makes them more supported, and it just facilitates better care throughout the whole journey, really. And finally, part of my CNS role is being accessible. So that means giving out my contact details. So as a CNS team, we have a joint email address and a joint phone number. Being able to contact us whilst we're not a 24-hour service, I know we've had a lot of feedback from patients that find having one person that they can go to just for an extra level of support, advice, any questions that they may have, they find it really helpful just having that one person that they know that they can go to and is easily contactable, whether that be discussing their treatment, whether that be, a lot of the times we give patients information leaflets at least 24 hours prior to starting treatment. We generally say go home and have a read through that and get in touch with us with any questions. A lot of patients actually do. They just want a phone call to talk through their treatment, any side effects, the risk versus benefits of starting treatment, and obviously understanding what will happen, the implications of not starting treatment. Why is this role important? So it enhances patient-centred care by making you guys active partners in your care, and it improves treatment adherence and satisfaction and reduces complications. The more you understand about your treatment, the more well equipped you are to escalate any concerns that you have, any side effects, so that we can act promptly. And obviously, different treatments suit different people very differently. You're all individual. It might be a case of me discussing with your consultant team, letting them know any side effects you're having, getting you in and discussing different treatment options. It also fosters holistic support by addressing your psychological and social aspects. So like we've discussed, it's not just as simple as here's this treatment, you have it now. There's different, in CLL we're quite lucky that there's different types of treatment that you can have. It's assessing which is best for your needs at the time. And it empowers patients through education and tailored communication. Whilst we, as a team, will advise on what treatment is best and what we would advise at your stage of your disease, at the end of the day, you're at the centre of your care. So it's for you guys to decide what works best for you, your lifestyle, your needs, and we work together as a team. This triangle is exactly right. It's a partnership. I suppose sometimes my role is considered a bit of a middleman. I'm in between. I'd like to build a relationship with patients quite closely so that they know that they've got someone there. But then I also work really closely with the consultant team, the wider MDT, and local teams at home. That involves referring you on to teams or social support that you may need throughout your care, discussing with your GPs, district nurses if required. All these different things come into play. And me being the middleman, in a way, in a term, I can liaise that with your MDT within the hospital, external teams, and obviously you guys, putting you back at the centre of your healthcare.
Thank you so much, Rachel, for that. But I guess that, we've talked about in terms of treatment, and I think the key to this is it's contextualising the information. It's getting it right in terms of when. It's a team approach in terms of thinking about what the treatment is, but I think it's also just to illustrate the fact that in a good way, it's difficult to sometimes say what the best treatment is, but I think to take away from the fact that whatever the treatment is, that the good thing is it's hugely better than it was 10 years ago. It's continued to evolve, and even as a snapshot of what we're doing now, it's very effective, and that it does mean that these things we talk about, prognosis and life expectancy, we're kind of functionally reinventing this, because what we're doing now is changing the natural history of disease in real time. So it's not perfect, can't be cured, but there is definite scope for positivity. Thank you.